Metabolism, Part 2. This time we will go into the discussion about the basic components of life, beginning with proteins. To begin the discussion of proteins, we will look at the functions of proteins. We have the plastic, or the structural function, catalytic, energy function, endocrine function, homeostasis, shipping, specific protection, transfer of genetic information. Here we can see various types of proteins, such as hemoglobin, antibodies, immunoglobulins, and albumin. Classification of proteins. Simple proteins consist only of amino acids, such as albumins, globulins. Complex proteins consisting of a protein part and a non-protein prosthetic group part. Chromoproteins, hemoglobin, myoglobin. Phosphoproteins, glycoproteins, mucoproteins, metalloproteins, lipoproteins, and nucleoproteins. Proteins of blood include the total protein count, which we have in the first 14 days of life, as 51, and in the later period, about 6 to 15 months, about 60. These proteins are composed of albumins and globulins. Globulins are composed of alpha 1, alpha 2, beta, and gamma, in total making up the 40%. Amino acids. Of the 20 amino acids that make up proteins, 12 can be synthesized and are referred to as non-essential. 8 are not synthesized in our body, and they're called essential amino acids, such as valine, leucine, isoleucine, theanine, methionine, phenylalanine, tryptophan, and lysine. 10 are essential for children. This includes arginine and histidine. This is in brief a guide to the 20 common amino acids. Please take a look. This shows the various classifications by which we classify amino acids into various groups based on their chemical properties. Now let's take a look at disorders associated with dysfunction of the protein metabolism in the body. One such disorder is phenylketonuria. Phenylketonuria is tested as part of the neonatal screening. One of the major manifestations of phenylketonuria is the appearance of convulsions or seizures. But let's take a look at the symptoms. At first, there aren't any symptoms. That's why neonatal screening is of such high importance to making an early diagnosis, as a late diagnosis can result in already irreversible changes of the child's body. If not treated, it can result in brain damage, epilepsy, convulsions, seizures, stunt growth, and of course, eczema of skin. Now, let's take a look at nitrogen metabolism. deamination of amino acids, cleavage of amino NH2 group, conversion to urea in the liver, excreted by the kidneys and the sweat glands, uric acid, decay of nucleic acids, and creatinine, muscle breakdown of proteins, as excreted is excreted as creatinine. You can see the basic reaction. And here you can see the full pathway. Let's move on to the function of lipids. There are structural components of cells. They're also a reserve or a form of metabolic fuel. They are a form of transport. They have a protective function, and of course are necessary for the implementation of a number of normal body functions. Here you can see the main part of the membrane, the phospholipid. And of course, you have to understand that to go into depth of phospholipids, you could probably write a book or several, as one is presented here. Classification of lipids. Derivatives of fatty acids. We have simple lipid, complex lipid, and derivatives of isoprene, which gives us in simple lipids as neutral fats and wax, complex lipids as phospholipid glycolipids, derivatives of isoprene, steroids, and carotenoids. You can also go with the division of saturated fatty acids, listed below, and unsaturated fatty acids. Obviously mentioning that we have two that are essential, the linoleic acid and arachidonic acid. Main plasma lipids. We have three non-esterized fatty acids. Triglycerides, which gives us three esters of fatty acids like glycerol. Phospholipids, glycerol, fatty acids, phosphoric acid, nitrogen compounds. Cholesterol esters, free cholesterol, metabolically active, part of the cell membrane, cholesterol esters, a form that is transported and deposited, is located in the cortex of the adrenal glands as a precursor of the corticosteroids. Atherosclerotic plaques, age dynamics of blood cholesterol. As you can see, in different age groups, blood cholesterol levels have a different normal levels, and in older men and women, there's also a significant difference between the blood cholesterol levels. Furthermore, lipoproteins can be divided into classes. The classification of major types of lipoproteins is based on their density obtained by flotation ultracentrifugation analysis. The density range for each class is shown. In addition to the lipid and protein contents, the lipid being in red and the protein in blue. Let's move on. Diseases associated with lipid metabolism. So a disorder of lipid metabolism can cause, for example, Gaucher's disease. Primary substrate of the disease reduced levels of enzyme glycocerebroidase, lipid accumulation in the lysosomes, glycocerebroidase cells of monocyte macrophage system, and the appearance of the Gaucher cells, that is the primary substrate. As you can clearly see, we have children who have hepatosplenomegaly, and of course developmental problems. The enlarged abdomen is due to the hepatosplenomegaly. Here is the histological presentation of the Gaucher cells. All right, let's move on to the carbohydrate metabolism. A set of processes convert monosaccharides and their derivatives and homopolysaccharides, heteropolysaccharides, and different carbohydrate containing biopolymers, glycoconjugates in the body. The result of carbohydrate metabolism, there is an adequate energy supply. Functions of carbohydrates include the energy, plastic, provision of nutrients, and protective. Here we can take a look at the main glycolytic pathways. We have the transformation of glycogen into glucose, and of course, the pathway can go into reverse. So, as the energy is being stored in glycogen, it can be released via this biochemical mechanism to produce glucose, which can be used by other tissues. And in more detail, you can see the synthesis of glucose, gluconeogenesis, from non-carbohydrate precursors. The process is always reversible. We have glycolysis and gluconeogenesis always going in bidirectionally, and it's just a question of which process is going faster at this time that leads to either the formation of glucose or its utilization. Disorders of metabolism associated with carbohydrate metabolism insufficiency. So one such example is galactosemia, absence or reduced activity of galactose 1-phosphate uridyl transferase. The accumulation of metabolic products such as galactose 1-phosphate, toxic effects on the central nervous system, brain edema, hypoglycemia, liver damage, hemolysis, anemia, eye involvement such as cataract, and of course, general wasting. For galactosemic infants given milk, unmetabolized milk sugars build up and damage the liver, eyes, kidneys, and the brain. Glycogenosis, glycogen storage diseases due to deficiency of some enzymes. According to clinical features, distinguish three forms: liver form, generalized, and muscle form. So we have type 1 Gierke disease, glycogen hepatosplenomegaly with decreased glucose 6-phosphate, if you remembered from the previous slide. Glycogen is primarily deposited in the liver, less so in the kidneys. We have type 2 Pompe disease, glycogen with cardiomegaly, absence of lysosome alpha, glucosidase, or gamma amylase. Glycogen accumulates in almost all tissues and organs. In the fifth type, we have myocardial disease, muscle phosphorylase deficiency with muscle fatigue, seizures, myoglobinuria. Main clinical signs of congenital metabolic disorders. So in general, if a child has diseases of metabolism, what are some of the general signs or warning signs that a doctor should try to immediately note in order to begin suspecting a congenital metabolic disease? These include recurrent vomiting, especially in the absence of signs of intoxication or the possibility of any kind of intestinal infection, quote unquote food poisoning. Strange smell of urine and sweat. There are, of course, certain diseases that have a very specific smell of urine, in fact, referred to as the maple syrup urine syndrome. Seizures. Seizures are a big one. They're always considered a critical clinical sign that uh, requires hospitalization and a diagnosis to be made. And one of the possible ones that you should consider in these cases are, of course, congenital metabolic disorders. Hepatosplenomegaly, as we've observed from several slides, and of course, there are many, many, many more metabolic diseases. The ones that I showed are just the tip of the iceberg, just an example to be presented. Delay in neuropsychological development. Severe acidosis, of course, if we have metabolic disorders, this can lead to metabolic acidosis. Hyperammonemia, the presence of a family history of death at early age. And stunting, the child is not growing. Signs of acute metabolic disorders. Acidosis or ketoacidosis may be a sign of acute metabolic problem. Ketoacidosis, for instance, would appear for diabetes mellitus. Diabetes mellitus is a metabolic disorder characterized by the absence of glycemic control, more specifically, the absence of the body to have the ability to control its glycemia level and not decrease the blood glucose, hence leading to hyperglycemia, which may come with or without ketoacidosis, depending on the situation. Hyperammonemia, hyperventilation to compensate problems of metabolic acidosis, and of course, epileptic seizures, change of consciousness, drowsiness, somnolence, lethargy, stupor, sopor, and of course, coma, violation of muscle tone, hepatomegaly, and jaundice associated with hepatomegaly mostly, but could also be hemolytic. And that's all for this lecture. Thank you.